Discharge Day is very exciting for you and your family. We want to make sure that you are ready to care for your baby safely and confidently at home. Please follow up with your baby's pediatrician within 1 to 3 days after discharge. You will be asked to make this follow-up appointment before you leave the hospital. Nurse your baby on demand at least 8 to 12 times in 24 hours. Babies may cue you that they are hungry by fidgeting, sucking on their tongue or lips, or moving their head from side to side. Try not to go longer than 4 hours without waking your baby to eat. Your newborn should not drink water or juice. There are feeding apps available that may be helpful for you to keep track of your baby's feedings, or you can keep a written log. Many new mothers are unsure if their baby is getting enough to eat. You know that your baby is getting enough if they seem satisfied after eating, are gaining weight, and have at least 6 to 8 wet diapers a day by about a week of age. Initially, your baby will be getting colostrum, which is low in volume but high in calories and nutrition. Your baby may want to eat frequently, sometimes every hour or two. It's important to feed your baby frequently, as this will help your mature milk to come in sooner. If you have questions or concerns after you are discharged, you can contact Lovelace Lactation Services. An easy way to remember how long your breast milk can be stored is by using the rule of 4. Freshly pumped breast milk is usually good up to 4 hours at room temperature, and up to 4 days in the refrigerator. Frozen milk is good for up to 4 months in the freezer. Frozen breast milk that has been thawed is only good for 24 hours in the refrigerator. If your baby has been discharged from the NICU with fortified feedings to increase calories for growth, or your provider wants you to supplement breastfeeding, or you are formula feeding, your baby's nurse will give you specific feeding instructions. Instructions will include safe preparation, feeding, and storage of your baby's milk. You should hold your baby upright to semi-upright if feeding with a bottle. Never prop the bottle on a pillow, as this may cause your baby to choke and aspirate the milk or lead to ear infections and tooth decay. Do not reuse the same bottle of express breast milk or formula for more than 1 feeding. Throw away any leftover milk after a feeding or after it has been about an hour. Be sure to keep your baby clean and dry by changing their diaper with each feeding or as needed. Use unscented baby wipes or soap and water to cleanse your baby's skin after every diaper change. If you see redness in your baby's diaper area, over-the-counter zinc oxide ointment or keeping the skin open to air will help with healing. Avoid baby powder in the diaper area. Be sure to clean your baby girl from front to back to prevent infection. Your baby should be having at least 6 to 8 wet diapers by about a week of life. Bowel movements can vary from 6 to 8 each day to 1 every other day, depending on what baby's eating. Breastfed baby's stools are mustard brown in color, loose, soft, and seedy. If your baby is drinking formula, stools may be green to brown in color and pasty to semi-formed in texture. It is never normal to have blood in the urine or stool, but sometimes girls may have a bloody vaginal discharge in the first 2 weeks of life from mother's hormones. If your son has been circumcised, you will receive instructions on care from your baby's nurse. An uncircumcised penis requires no special care. It is not necessary to cleanse under the foreskin in the newborn period. Keep your baby's umbilical cord clean and dry by folding the diaper below the cord. If the cord becomes soiled, clean it with warm water. Your baby's cord will fall off within a few weeks and you may notice a little blood at that time, which is normal. Watch for signs of infection at the cord site, such as redness on the skin surrounding the cord, swelling, a foul odor, or drainage. If you see this, call your baby's doctor. Bathe your baby about every 2 to 3 days in a warm room away from drafts. Give your baby a sponge bath until the umbilical cord falls off and heals. The temperature of the water should feel warm, not hot, by checking it with your inner forearm. Remember, clean to dirty when giving your baby a bath. Start by washing face first with clean water, then you can use a mild unscented baby soap and cleanse the rest of the body, working your way to the dirtier parts, cleaning bottom last. Keep the parts of the body that you are not washing covered to help baby stay warm. Wash baby's head last and dry it right away. Remember, never leave your baby in the bathtub alone. Avoid using baby powder, which can be harmful to baby's lungs. Use one product at a time in case your baby has sensitivity to it. Infants younger than 6 months should stay out of the sun. Continue doing skin to skin with your baby at home. It's good for your baby and for you. Keep a bulb syringe near your baby's bed and have one in your diaper bag. If your baby has spit up and is having difficulty clearing the milk or mucus from their mouth and nose, turn your baby to their side and suction mouth first and then nose. Squeeze the air from the bulb syringe, then insert the tip into the side of your baby's mouth and release to suction the spit up. Remove the tip from the mouth and squeeze the contents into a tissue. Repeat as needed. Newborns need to breathe through their nose, so you may need to suction the nose after suctioning the mouth. Their nasal passages are small, so don't over-suction the nose, as this may cause swelling. If your baby has congestion, a few drops of pediatric nasal saline can help loosen the secretions, making it easier to clear the mucus. Newborns are at a greater risk for infections because of their immature immune system. Good hand washing is the best way to keep your baby well. You should teach your other children to wash their hands with soap and water for at least 20 seconds before handling the baby. Alcohol-based hand sanitizers may be used between hand washing. Limit the number of visitors coming to your house and make sure everyone is well. Anyone who is sick should postpone their visit till they are completely well. Prematurity, chronic lung disease, and heart conditions can make babies more vulnerable for serious complications. Try to avoid crowded places, such as malls, churches, and restaurants. If you must take your baby with you, use measures to keep distance from others and cover your baby's carrier. Do not allow smoking anywhere in your home. If someone is a smoker, be sure to have them wash their hands and face and put a clean barrier between your baby and their clothing. Exposure to smoke can irritate your baby's lungs and increase risk of infections. Parents should be up to date on their own vaccines and receive the flu shot during flu season to help protect their infants. If you notice changes in your baby's behavior, such as irritability or abnormal sleepiness, not eating normally, or your baby just doesn't look or act right, take your baby's temperature and call the doctor. We recommend taking your baby's temperature under the armpit. Be sure you know how to use your thermometer correctly and that it is acceptable for use on newborns. Call your baby's doctor immediately for temperature over 100.4 or under 97 degrees Fahrenheit. If your baby is having difficulty breathing or changes in skin color, especially around the mouth, blood in urine or stools, any head injury, or seizure-like activity. Also call your doctor if your baby is having vomiting or diarrhea, and if your baby's eyes or skin color becomes yellow. This is called jaundice. Jaundice is a common occurrence in the newborn period and usually peaks around 3 to 5 days of life. It is caused by the breakdown of red blood cells, which release the yellow bilirubin pigment that show up on your baby's skin. If your baby's bilirubin level gets too high, it may need to be treated. If the bilirubin level is too high and remains untreated, it can be very harmful to your baby's brain. Be sure to call your doctor if your baby is looking jaundiced. If your baby is ill, make sure to talk to your doctor before giving any medications. SIDS, or sudden infant death syndrome, is the sudden unexpected death of an infant without a known cause and is the leading cause of death among babies between 1 month and 1 year of age. SIDS is not caused by immunizations, vomiting, or choking. You can help your babies sleep safely and reduce their risk of SIDS by following the recommendations of the American Academy of Pediatrics and National Institute of Health. Sleep your baby in your room, but in their own crib or bassinet. Babies should not sleep in an adult bed, waterbed, a couch or chair, or next to any other warm body. Use a firm sleep surface, such as a mattress, in a safety-approved crib, covered by a fitted sheet. Keep soft objects such as pillows, blankets, crib bumpers, toys, and loose bedding out of your baby's sleep area. Make sure nothing can cover your baby's head. Always place your baby on their back to sleep for naps and at night. Dress your baby in sleep clothing such as a one-piece sleeper, an appropriate size sleep sack, or wearable blanket. If it's cold, dress your baby in layers. Do not use a blanket. Do not let your baby get too hot. Flushed cheeks, sweating, damp hair, heat rash, and rapid breathing are signs that they could be too hot. Do not let anyone smoke around your baby. Consider using a pacifier without cords or clips at nap time and bedtime. Breastfeed your baby for as long and as much as possible. Talk to others who care for your baby, including family, friends, babysitters, and childcare providers, about making sure that your baby is sleeping on their back during naps or at night. Have you ever heard of tummy time? It should be part of your baby's daily activities and done while your baby is awake and being supervised. Tummy time helps build strong neck and shoulder muscles and helps prevent flat spots on the back of your baby's head. You can start with 3 to 5 minutes of tummy time 2 to 3 times a day and increase the length of tummy time as baby gets older. Your baby may not enjoy it right away, but it will help them build strength as they grow for sitting up, rolling over, and crawling. Babies sometimes cry a lot in their first few months of life. Many babies have an increase in crying episodes starting at 2 weeks and peaking at 2 months. Usually it starts to resolve within 3 to 4 months. It is important to make sure that baby is not sick. If crying is associated with an abnormal temperature, poor feeding, diarrhea, or vomiting, you should call your pediatrician. It can be frustrating for parents if baby's not sick, but has bouts of crying. Check to make sure baby is fed, burped, clean, and nothing is hurting your baby. Try to calm your baby by giving them something to suck on, like a pacifier or your clean finger. Swaddle your baby and gently rock or place baby in a swing for a slow swinging motion. Hum in a low tone against baby's head. Run some white noise like a vacuum, water in the sink, or a dryer to distract baby. Sometimes everything you do does not help to soothe your baby. It is important not to get angry and lose control. It is best to put your baby down in a safe place, like their crib, and walk away for a few minutes. Take some deep breaths or call a friend if you need to. Be sure to check your baby every 5 to 10 minutes or if they have suddenly stopped crying. Be sure your baby's caregivers know that it is okay for them to call for help when needed and make a plan to handle those stressful times. It is important not to shake your baby if you are frustrated, as this may cause lifelong brain damage or even death. According to the law, you must always transport your infant in a child safety seat while riding in the car. Parents, you are responsible for reading the car owner's manual and the car seat instructions before the day of discharge so that you know how to properly use and install your car seat. Some infants may need to pass a car seat trial before discharge to make sure baby is safe in a semi-upright position. Your nurse or provider will let you know if your baby needs a car seat evaluation. Your baby should ride rear-facing in the backseat of your car. The shoulder straps should be at or slightly below the level of your baby's shoulders. After you have buckled your baby in, adjust the leg straps so that they are snug, then tighten the shoulder straps. The chest clip should be at armpit level, and you should be able to slide only 2 fingers between the clip and your baby's chest. Your nurse will help you with a good fit when it's time to take your baby home. Remember not to use a car seat that has been in a crash or recalled. Don't use a secondhand car seat since you don't know if it was in a crash. Never use padding that did not come with your car seat. Only use the car seat for transportation, not as an infant seat. Developmental milestones are things most infants and children can do by a certain age. Your pediatrician will evaluate your baby's progress at each well-baby visit. If your baby was born prematurely, the age at which they are expected to reach various milestones is based on due date, not birth date. If you think your baby is lagging behind, talk to your pediatrician. Babies born prematurely or who have spent a lot of time in the NICU will be referred to early childhood intervention and special baby clinic to make sure that they have resources they need to develop on track and reach their potential. How do you know if your baby is tired, hungry, wants to suck, or be left alone? Your baby can show you cues to some of these behaviors. For instance, if your baby is hungry, they may lick their lips, move their head from side to side, or try to suck on everything that touches their mouth. You may be able to read baby's cues before they even start to cry. Baby has a call for hunger, which is different than a cry when they are in pain. They may move arms, legs, and hands in certain ways or use their eyes to cue you. The more time you spend with your baby, the more you will be able to read your baby's cues. At home, remember to take care of yourself and rest when your baby sleeps. Accept or ask for help from relatives or friends. If you have questions or concerns after you leave the hospital, your baby's pediatrician will be your best resource. Most of all, enjoy your baby. Congratulations from the staff at Lovelace.